Hello and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class healthcare provided at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units to soldiers, their families, retirees, and other beneficiaries. A trip to the dentist is a required stop on the road to readiness. All soldiers must ensure they maintain a deployable dental readiness classification. Jerome Banks has the story of one tool regional dentists are using. It helps them find dental problems efficiently and develop treatment plans to fix them.
We traveled to the dental facility at Fort Lee, Virginia to see what's behind this curtain.
Cone beam, CBCT, CBVT, it goes by a lot of acronyms, but it's basically cone beam.
That sounds like quite a mouthful, but what does it do?
It basically gives us very specific information that can help us home in and make sure we get the best treatment for that patient based on their need in the most efficient amount of time and the most accurate data coming in.
This clinic is responsible for treating 12,000 Army trainees and ensures that soldiers are worldwide deployable. I had a chance to speak with one of the patients.
I'm actually here because I was having a little pain in my lower jaw. And I decided the pain was too much, so I decided to come in for sick call.
Now it's time to use that cone beam to get to the root of the problem.
Is your chin resting all the way in this thing? All right. Yeah, just like right there. These are the people who are out there protecting our interests for America, protecting our freedom, protecting us. So the least we could do is make sure they don't have a toothache. Okay, here we go.
One of the best benefits of cone beam is its ability to do 3D imaging. X-rays are more two-dimensional. Looking at me in real life 3D and my hand and everything as you see it now versus looking at my hand drawn on a piece of paper or a photograph of it.
You can see that there's a little bit of a discrepancy between where the tooth stops and where the filling begins. That looks like there may be a problem right there.
When you're in the dental clinic, it doesn't hurt to ask questions.
Patients come in, they say, am I going to get a shot? And I say, yes, you are. Unfortunately, but it's not going to hurt. It's going to be fine. You know, you'll get through it. I'm
here to just get out of pain. That's the reason why I'm here, and if this helps, then that's cool with me.
Yes, the Army says we have a wellness readiness mission, and we must meet that, and we will meet that. As I was told, BFF, brush and floss forever. So that's always a start. So good oral hygiene is what we encourage with each and every patient, regardless of what you do or why you're here.
And that's good advice, both for protecting your smile and for staying dentally ready to deploy.
When a Georgia high school asked for help, the Regional Health Command Atlantic team at Fort Stewart and Hunter Army Airfield answered the call. They sent a team of nurses to Hinesville, Georgia, not to practice healthcare, but to teach it.
Soldiers and civilians from the Fort Stewart U.S. Army MEDAC Ambassadors Speakers Bureau took the opportunity to share their professional expertise in healthcare to students from Bradwell Institute.
I think it's going very well so far. The students are asking questions, they are engaged, and they're actually getting a pre-review of things that we'll be talking about later.
Human anatomy teacher Pamela Donald wanted to give her students a real-life perspective on the subject matter, rather than just learning from a textbook. She put in a request to have military health professionals come to her classroom to teach.
They actually have experts who are actually doing that particular job, coming in, talking to them, giving them those personal experiences and outlooks.
One ambassador, Diane Carlton, a nurse and health promotion coordinator at Winn Army Community Hospital, immediately jumped at the chance to teach these young people about Army public health nursing.
This is a great opportunity for us here in the classroom, even as Army public health nursing. It gives us a good experience to come outside and touch the community beyond Fort Stewart, beyond Hunter. But it's going to help us understand more about what the needs are within the community by talking to the students today.
¿Dónde afecta qué lo puede causar? Las personas que están alrededor tuyo, que pueden salir afectadas y todo eso.
For the ambassadors, inspiring young minds and connecting with the students at Bradwell is an essential opportunity.
This is going a step further and going out into the community to those folks that are here living amongst us that are young enough yet they haven't made career choices and maybe are thinking about it, to get them at this point where they're thinking about what they want to do and how they want to do it.
Major Beatrice Martinez, a nurse practitioner at Tuttle Health Clinic, used her personal experiences and images from her deployment to convey the neuromuscular material in a way that the students could connect with. This is the second time this quarter the ambassadors had the chance to lend a helping hand to the students, teachers, faculty, and staff at Bradwell. The presentations went so well, U.S. Army MEDAC ambassadors have been asked to come back to the school during the spring semester to instruct a new group of students. For the Regional Health Report, I'm Zach Renstrom.
Army medicine ambassadors across the region interact with their local communities in ways that build bonds and promote a culture of health. In other news around the region, the same organization that helps warfighters map the battlefield is helping retired wounded warriors find their course after they leave active duty. The National Geo-spatial Intelligence Agency shares a special bond with our warrior transition team. Several retired soldiers who were wounded, injured, or severely ill now work for the agency. The Fort Belvoir, Virginia Warrior Transition Battalion recently welcomed NGA leaders with tours highlighting services available to recovering soldiers. They visited Fort Belvoir Community Hospital's National Intrepid Center of Excellence for Traumatic Brain Injury and the Post's Soldier Family Assistance Center. They also received a brief from the battalion highlighting all of the support available to soldiers in transition. Transition coordinators across the region work hard to establish relationships with agencies that are looking for high-quality people. Army veterans have the discipline, skills, and leadership abilities they want in new employees. That's the Regional Health Report for January. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. Thanks for joining us.